Murphy's Town Hall. We are so excited to have you. Everybody is getting into our Zoom room. We're also going to be live on Facebook. So we'll give everybody a couple more minutes to get settled in your favorite seat with your favorite beverage of choice, nice and comfortable, and we'll kick it off with Governor Murphy in just a minute or two. Welcome, everybody, and thank you for joining us. All right. I think with your permission, Governor, we'll kick it off if that's okay.
Fantastic.
All right. Good evening, everybody, and welcome to Governor Murphy's Spring Town Hall, virtual Town Hall. My name is Deborah Cornavaca, and I am honored and thrilled to be here with the Governor this evening and all of you. We know we have a few people still coming into the room, but we want to get started because we have a lot to cover. It has been a tremendously busy 2021 and a remarkable past 12 months. And so we want to give the governor an opportunity to provide a few remarks at the top, and then we're going to go through some of the questions that people submitted in advance. We will welcome questions in the chat room that we can try to address after. We don't know if we'll be able to get to them today, but we are so grateful for all of you to join us and the opportunity to hear directly from the governor. So without further ado, Governor Murphy, please everybody help me welcome the great governor of the state of New Jersey, Governor Phil Murphy.
Hello, everybody. Deb, thank you so much. Michelle D'Angelo, thank you as well. And Deb, you've been extraordinary in this, particularly over these past 12 to 13 months. On the questions, I know Deb well enough to know she didn't pick the easy ones, if my suspicion is correct. And secondly, the point Deb made, I want to underscore. If we don't get to your question, I'm proud of our track record, again, largely thanks to Deb and her team of following up and getting you an answer at some point after our hour together. I will make some brief introductory comments and keep most of this hour together focused on your questions. Sort of in my comments, I wanted to touch four different things: the pandemic, the economy, the American Rescue Plan, and our budget. On the pandemic, it's a lot better than it was a couple of months ago, but we're still in the fight. We've administered now, we've crossed well over 3.5 million shots into arms. If you look at the amount of shots into arms as a percentage of the amount of doses that have come our way, we're, I think, number 4 in America. And the 3 states ahead of us are smaller. And so I know it's frustrating for folks who are not yet eligible or can't yet get an appointment, but increasingly there's a shift in the center of gravity in the state from those who are trying to get an appointment to those who have got one or actually have been able to get their vaccinations. And that's only going to get better. We're still in a supply-demand imbalance, but I think beginning as early as next week, the feds, the issue is we don't have enough supply from the feds. I think that's going to begin to change. Now, the vaccine isn't the only show in town. On the negative side, we've got these variants. Whether they be Brazil, South Africa, UK, New York City, whatever it might be, they're in New Jersey. And we're still in the thick of the fight here. We're the densest state in America. We're in the densest region in America. And both of those reasons, plus you combine that with cold weather that we've had over the past couple of months, we're still in the thick of this thing. Our positivity rate is too high. So we need folks not just to get vaccinated, but to continue to do the basic things: wear face coverings, social distancing, washing hands with soap and water. I really believe we're on the cusp of breaking to a much better place. I mentioned, I think, increased vaccinations coming from the feds beginning next week. I think when we get to Memorial Day a couple of months from now, we're in an incredibly and dramatically different place as a state. But again, it requires all of us to continue to be vigilant, doing the right things, even if you've been vaccinated. You got to still wear the face coverings. Our objective is to get to 4.7 million adults vaccinated, at least with a first shot. We're almost halfway there. And as I say, the supplies will increase and the pace of getting those vaccinations out there will pick up. We're in 725 different locations right now, and that number is only going to go up in terms of distribution points. If I'm right about the pandemic, and by the way, warmer weather is another positive here. The more we could do things outdoors, the less lethal the virus is. That's a good thing. So use this beautiful spring day and many more this week, and hopefully many more to come, to get outside as much as you can. If I'm right about the pandemic and Memorial Day, the economy is going to snap back. And God knows we need it, particularly small businesses, restaurants, bars, folks who have been unemployed, many other needs that we have right now, folks who are in arrears on rent, mortgage, utility payments, who need childcare support, frontline workers, whoever it might be. That economic recovery could not come a moment too soon. And again, if I'm right on the pandemic, the recovery will snap back. I signed a package of incentives in January. Those will help us recover, and that's going to be fuel to our recovery. I mentioned the third item was the American Rescue Plan, passed by Congress, signed by President Biden a couple of weeks ago. That is also fuel to our recovery. That's going to allow us to keep the frontline workers in their jobs delivering services, to get help for daycare, small businesses. You know, I think we've helped, our Economic Development Authority has helped 65,000 small businesses, but no American state has the amount of money that the feds can put to work. And God knows our small businesses need even more help. And so that American Rescue Plan, passed by Congress, signed by President Biden, is exactly what we need, whether it's frontline workers, I mentioned arrearages, child care, unemployment insurance, helping fund our vaccination efforts, our ongoing testing efforts, whatever it might be. That's going to be a really important tool for us. And then lastly, the budget. I presented the budget a few weeks ago, and it's funny, in some cases over the past year, everything has changed. In other cases, it has been a continuation of a journey we started on even before I got elected. That's stronger, fairer, and now more resilient New Jersey. And so our budget obviously addresses the inequities that have been laid bare by this pandemic. It addresses the needs that have only gotten more compelling, like childcare, public education, higher education, public health. But it also continues and extends many of the journeys that we've been on, including things like making community college more affordable for thousands more, now making college more affordable for thousands more, funding women's reproductive rights and health programs, covering all kids in health insurance, being much more aggressive about infant and maternal mortality inequities that my wife Tammy has been leading on. The whole range, the whole waterfront. And by the way, outside of the budget, at long last, addressing the social injustices associated, by example, with outdated marijuana laws, and establishing a new industry at the same time, while at the same time protecting our kids. So those are sort of the four pillars I wanted to start off tonight. Where are we on the pandemic? If I'm right on that, where's the economy going to be this year, in particular second and third quarter? How the federal money will help us recover. And fourthly, our budget, which both addresses the inequities and challenges posed by COVID, but at the same time continues on the many journeys that we've been on now for over 3 years. I'm incredibly humbled you take some time this afternoon to be with us. On behalf of Deb, Michelle, and myself and our whole teams, we thank you. With that, I want to turn it back to Deb, get my glasses and pen in hand, and fire away on any questions you might have.
Great, thank you, Governor. And just to give you an overview, we have about a little over 200 people here on Zoom with us, and I'm pretty sure we're just about every county in the state represented. I do see we have a few veterans with us. A special shout out to our veterans, and so many other friends and great organizations joining us this evening, also live on Facebook. So thanks everybody for being here. We got a lot of questions on a lot of different topics. So I'm going to try to jump around a little bit, Governor. I know you'll be able to keep up without any problem, and we'll see how many we can get through.
We'll see.
I think one of the first places I wanted to start was a really poignant question that I think maybe was even submitted before the tragic murders in Georgia. But it's from Leslie up in North Jersey that New Jersey has the most people arrested for participation in the insurrection on January 6th. What are we doing as a state to combat these radicalized, increasingly dangerous groups?
Wow, I was not aware, if that's true, that we have the most amount arrested from January 6th, but that is certainly not a badge of honor, that's for sure, if it is true, Leslie. So thank you for bringing that. I know a bunch of folks have been arrested from New Jersey. And then you had, Deb, I think you said that this question came in
even before the shootings
in Atlanta, right? So, by the way, I'm speaking of Atlanta, maybe this is part of my answer for Leslie. I'm actually doing a virtual event with Congressman Andy Kim, literally tomorrow, on this very topic of anti-Asian hate action and hate crimes. And we've got it in New Jersey. Thank God we haven't seen the level of tragedy that we saw in Georgia, but we've got one of the fastest growing Asian American populations of any state in America. It might actually be the fastest growing community in our state. With a particular big presence up in Bergen County. And that community has been under assault, and it's unacceptable. You know, our Office of Homeland Security and Preparedness, led by Jared Maples, who does a great job, works really closely with law enforcement. I've seen it with my own eyes on now almost countless occasions. In fact, I'm going to be having a meeting, ironically, with Jared Maples tomorrow on some of this stuff as well, separate from the viral event with Andy. The coordination and cooperation across law enforcement, including with federal partners as well as neighboring states, is outstanding. Now, that doesn't mean you have to bat 1,000 on something like this. You have to get it right every single day. The Office of Homeland Security and Preparedness also hosts the Interfaith Advisory Council, which is, I think, got 3,000 or 4,000 members, and that has grown like a weed. And by the way, I must add, it existed before I got here. We have promoted it. I think we've strengthened it, but it was something that was already in place, and that's in all 21 counties. You mentioned questions or participants from all 21 counties. And I think the last thing I would say, there's no easy answer here, because, and I'm trying not to be political, Leslie, but we've come out of a 4-year period when the highest office holder in the land continued to create an us versus them culture. And I think the key for us now is for communities and government and law enforcement to come together to re-bridge those gaps and heal those wounds. There's no easy answer. I'm not suggesting this couldn't happen in New Jersey, but I am suggesting that we take this very, very seriously, and we'll continue to.
Thanks, Governor. I know also we're joined by a lot of healthcare workers here this evening. I know you'd share in extending our gratitude
Amen.
to all of them.
You mentioned healthcare workers and veterans. Bless them both and thank them both.
Pretty special crowd here. You know, you can imagine we did get a lot of questions around COVID, the pandemic, and the vaccine. So I'm just going to touch on a couple of them. I think you hit on this briefly at the top, but there is a lot of there are a lot of questions and concerns around these new variants. So Arlene asked us, how are you handling the new variants of this virus?
Yeah. Do we know where folks are from, by the way?
So no, I'm afraid we didn't collect that information, but I do believe Arlene is an educator in New Brunswick, so Central Jersey, at least in work.
Okay, let's shout out our educators in addition to veterans and healthcare workers. Again,
Absolutely.
Thanking them. Yeah, at one level, Arlene, right?
Yes.
At one level, Arlene, it is more of, in fact, it's probably overwhelmingly more of what we've been doing. And just we need continued vigilance. So there's no evidence that the variants, and we know they're in the state, and we've been assuming they've been in the state now for months. We didn't wait to get confirmation of that. There's no evidence that the basic stuff doesn't work still especially against severe illness, hospitalization, and please God, fatality. So face coverings, social distancing, washing hands with soap and water, take yourself off the field if you don't feel well or you've been exposed, wait a number of days, get tested. We've got one of the best testing capacities of any state in America. Those basics still work. The science is incomplete, Arlene. So what I've just said is to the best of the knowledge of the experts. And so I think the most important thing I can say is keep doing what you've been doing, and when it's your turn and educators have been up to bat for a couple of weeks, get vaccinated. Because the vaccines, the 3 vaccines, continue to show 100% effectiveness against severe illness, hospitalizations, and please God, fatalities. We'll continue to watch this like a hawk. We know that they're largely more transmissible. That we know, so it's more it's easier for you to get infected. The data is particularly incomplete on whether or not they're more lethal. And please God, they're not. So you've got a last comment here. You've got a race between, on the one hand, the variants and lethargy and letting our guard down. And on the other side, you've got vaccines, better weather, smart behavior like face coverings, and I would say incremental, I hope and believe, responsible reopening of the state. In other words, we don't get out ahead of ourselves like some other states have done. That won't happen. That's going to be an asset to us over the next couple of months. And we're going to be, focused on this. Arlene should know like a hawk. Thank you.
No spring break like Florida, right, Governor?
No, look at Miami Beach. But, it's hard to fathom how people, what are they missing here? Any event.
Well, one thing that some people are missing is an easy way to get a vaccine. And we did get quite a few calls about this or questions. So Stephanie expressed some concern about this. She asks, how are people 65 years and older supposed to get vaccinated when vaccine sites open up and 5 minutes later, all the appointments are gone? And it's hard to get on the phone to get appointments. It seems like you got to know the right person to get an appointment.
Well, I hope that's not true. So Stephanie, right?
Yes, sir.
We should make sure on something like that where there's a specific, I don't want to give you the impression, folks, that there's a magic wand and just because Stephanie asked that she's going to get the secret handshake to get a vaccine. But I do think on this one where it's something very specific, I think it is worth following up specifically with her. So we've opened up to 65 and up for several months at this point, at least a couple of months. If you're under 65 and you've got chronic conditions, you're also eligible. And then, as I mentioned, educators are eligible, healthcare workers, law enforcement, and then we opened up to other groups a week ago today, and there'll be more groups opened up a week from today. But one of the things Judy Persicelli, who's done an extraordinary job, concluded a few weeks ago, first of all, a couple of months ago, to Stephanie's point, not everybody goes online. Not everybody can sit online minute to minute and swoop in and get that appointment. So we opened a general call center. That had some teething challenges because we went from scratch into something now that has many hundreds of folks in multiple languages answering it. That number, this is a general one, is 855-568-0545. That's the general one, 855-568-0545. The website is covid19.nj.gov/vaccine. But to Stephanie's point, a few weeks ago, Judy further concluded that the 75-year-old and up cohort, and then the 65 and up cohort needed an extra reach out. And so we put doses aside. I think if my math is not right, I think there's 10,000 appointments each week that a specific senior call center has been allocated. And that's the second number I want to give. Someone just said, can we post the number? I want to make sure that we do both of these, Deb. And that is a senior specific hotline, 856-249-7007. Again, 856-249-7007. I think we're up to vaccinating 60% of all of our 65 and up population, at least with one shot. But listen, that still leaves a whole lot of folks who are not there yet. We continue to suffer from a supply-demand imbalance. We don't have enough vaccine doses from the feds, but the Biden team have done a great job getting that going in the right direction. I believe as early as next week, as I mentioned earlier, we're going to be in a meaningfully better place. And again, I don't blame anybody who's frustrated they can't get an appointment. I don't blame you. We're doing everything we can to get that supply-demand imbalance into balance and getting the access open up as wide as we can. I could go on. I'll leave it there. Deb, I only would ask if you could post. That would be great.
We got the phone numbers up there for you, sir.
Thank you so much.
And we'll follow up as well. You know, one of the things you've talked a lot about are different communities and parts of our very diverse New Jersey, which have really felt the impacts. We talk a lot about our Black brothers and sisters, our Black families, our Latino families, the disproportionate impact it's had on them. But it's also true, a question from Jahencia, I apologize if I'm not pronouncing your name correctly, but that the disabled community has been hit really hard by COVID. The pandemic has worsened a lot of issues that have plagued the disabled community in housing and healthcare, in day services. So she's wondering if there's any discussion around how to help the disabled community coming out of this pandemic.
Yeah, there are certain communities that have been crushed, and we know what they are. Long-term care, especially early on, communities of color, disabled, both developmentally and physically disabled, multi-generational family settings, essential frontline workers in some cases. And it is, you know, it's been a virus that has, I've said this a lot, it hasn't created the inequities, but it's exposed them. It's laid them bare. I think we probably all had a pretty good sense, particularly folks in those communities, I might add, that this all existed long before COVID. But boy, what a stark exposition. One point I want to make is, and again, I want to give Judy Persichelli credit. We submitted to the feds in this federal pharmacy partnership program that goes to long-term care, the broadest definition of long-term care facilities of any submission by any state in America. And it was explicitly to include homes of the disabled, developmentally, physical, and otherwise. And the feds, with one exception, which I think was our psychiatric hospitals, accepted our definition. That took us a little bit longer, but it was worth it in a big way. So again, we know that it is not just in the homes, in the group homes and congregate settings, but it's also disrupted the many critical services of the disabled community and their caregivers, by the way, it must be said. So we get this, we understand it. We're working closely with advocates to try to do, whether it's through our budget, whether it's through the latitude that we're given to spend the federal money. Deb, that's one thing I should have said. We need U.S. Treasury guidance on how we can spend the money. But that's an area where we can, you know, I'm hopeful that we can put serious resources to work. And again, between our budget, federal money, and again, getting people vaccinated, allowing, you know, prioritizing these communities. It's a combination of all that, I think, that ultimately gets us into a better place. But there's no denying the community has been disproportionately hit.
We will continue to work on that, I know, with you. Another group that we're going to talk about, and it is Women's History Month, and you know I wouldn't let it go without a discussion around women in the workforce and women in New Jersey. Couture raises the question around how many women have had to leave the workforce due to the unforeseen circumstances of coronavirus, especially Black and brown women. And what plans do you and the administration have to get working women back into the workforce?
And that was from, is it Couture, you said?
Couture, I think so.
Okay. Great question, Couture. So okay, again, back to the theme of disproportionate impact. Women, working mothers, women of color, working mothers of color. have paid a disproportionate price here, expected to be all things to all people in the workplace, at home, and everywhere in between. And so we've tried, listen, we have put a lot in place. Our budget puts a lot more in place. And this is another area where I'm optimistic we can use the federal money to aggressively go at that which we cannot get to ourselves. We have, when it comes to small business support, we have made in our recovery programs, we have disproportionately emphasized women, minority, veteran-owned firms, and we'll continue to do that. And I would say that we would do that as well with any federal money within the ability to do that. Our budget, Deb, I can't remember the exact number that's associated with it, has additional funding for Main Street recovery programs. It has a Black and Latinx seed fund as part of it, which I'm particularly proud of. We have a lot more money into the childcare, pardon me, and including monies to not just help people to afford childcare at the family level, but also at hundreds of millions of dollars to get childcare facilities reopened, get schools reopened. Nurture NJ, I mentioned earlier, which is the First Lady's leading a multi-departmental and advocate initiative to tackle the inequities in maternal and infant mortality rates in New Jersey, which are awful along racial lines. Those are some of the things. I'm not suggesting that is exhaustive, but again, on this one, it's everything we're doing that we've done already, our budget, but also I think most importantly going forward with the federal money that we'll get from the American Rescue Plan.
I think you mentioned in there education and school. And so if it's with your permission, I'm going to shift gears a little bit to a few questions we got on education, another hot topic. This one actually crosses between COVID. Well, most of them do COVID and education. Sammy wants to know, what are you doing in your budget to prioritize mental health and the mental health of students in schools and the risk of substance abuse and some of these problems that have really been exacerbated by COVID and so much remote learning?
Yeah, it's Sammy, right?
Yes.
I'm writing some of this down, so forgive me. Let's start with the premise that learning loss is real and mental health challenges for our kids, probably for all of us, but certainly for our kids, are real, period. And so I would say, Sammy, there are two specifics I can point you to, but I suspect there is a third coming. Number one, our budget that I proposed a few weeks ago includes a major investment into the program that's called the Children's System of Care, which supports kids with emotional and behavioral health challenges, as well as intellectual and developmental disabilities. It also addresses kids with substance abuse challenges, and that's also wrapped up in this, and we know that for sure. That's in our budget. Secondly, we did something that I don't think any other American state did. We got money out of the federal money from the package that President Trump signed on Christmas Eve. We got $1.2 billion to go into education. And we could, the guideline was basically allocated based on population. So our Department of Education, with an outstanding acting commissioner, Angelica Allen McMillan, made the decision to allocate of the $1.95 billion based on population per capita, but to take $105 million and split it into two buckets and sort of make these specific programs on exactly how the money needed to be spent, or at least thematically. $75 million on learning loss and $30 million on mental health, to Sammy's question. I'm not sure any other state in America did that. And by the way, those are the two thematically areas where the money has to be spent. There's a lot of latitude in terms of the proposals that districts can put forward in terms of how they want to address that. So for instance, a learning loss, is it a summer program? Is it after hours? Is it more professional development for educators, whatever it might be? And then the third piece, which again, I'm going to refer to this probably, I've already done this several times, I will come back to again, is God willing, we'll get constructive guidance from the U.S. Department of Treasury to allow us to spend monies right up against the mental health challenges. Clearly not limited to students, but very much with our students. And so for all those, our budget, the federal money that we've already allocated in, I think, a creative way, quite consistent with the moment we find ourselves in. And then thirdly, what I hope will be federal support to come from the American Rescue Plan.
A lot to work on there. And another project to work on with the federal government is our next question, which is from Gene from the Bayonne Education Association. He'd like to know what can be done to put pressure on the federal government to suspend the standardized testing that usually takes place in the spring.
Yeah, so this is, and by the way, Gene likely knows this. Is Gene an educator? I would think.
Gene is an educator. I think he's the president of the Bayonne Education Association, and we've actually met him before.
I know Gene.
Yeah, I think Gene, I don't want to say his last name on, Facebook, but I think we know who we're talking to here.
Okay. I know exactly who you're talking about. A good man. Hello, Gene. I hope you're out there. So last year we submitted a waiver and it was granted by the federal government. And I don't think anyone argued with that. That was not a complicated process because it made no, and by the way, people, I think, across the spectrum agreed that was in order. We have submitted yet another waiver this year. And Deb, you may have more up-to-date news than I have, but the waiver was denied. And it was denied in a I don't want to throw people under the bus here on this. It was denied on the basis that, in fact, back to the prior question, that some data, even if it's imperfect, will help us as a country assess learning loss. Is that a fair way to put it, Deb? Mm-hmm. We would say with great respect, it's very hard. When in experiments, you need control, the control factor. And it's so hard to find that control factor across all the districts and all the various modes through which kids have been going to school. And so we have submitted, Gene, yet another waiver. And there's I'm not suggesting everybody agrees on this, but there's a lot of agreement, Deb. I think you'd agree with me, among educators, administrators. I think a lot of moms and dads, it doesn't feel like it's fair. And it's not a fair assessment. I think whether it's fair, and we can have the argument teaching to the test, that's a valid one, and that's something that we should have. And I'm not a big fan of the white knuckle high stakes testing, but I've got 4 kids, you want to know how your kids are doing, but can you really draw a fair conclusion? I think is the rightful question. So Gene, we have resubmitted with great respect. And unless, Deb, you've heard something in the past couple of hours that I'm not aware of, we are still awaiting that response. At the end of the day, we have to do what the feds tell us to do. And we're prepared to go ahead in some form if need be. But that's where we have been. Is that fair, Deb?
I think so. And we know there's been a lot of support for this waiver, which has been great. I don't think anybody.
That's not to say we don't want to know how our kids are doing. No one disagrees with that. Educators, moms, dads, even the kids. You want to know where you need help, where you should be proud. All those sorts of things are valid, but I think you have to do it in a way that is a fair process. It is a fair comparison, and that's what our concern is.
And I think the commissioner has done a great job at figuring out other ways we can measure that this year without those assessments.
I agree.
A lot of hard work going into that. So one other question, I think, on education, if I might, because I think it's a forward-looking one, which is good. Tina wants to know, Tina's from the Plainfield School District, what is the reopening of schools going to look like in September?
In September.
Yeah.
Okay. So Tina, I will start in the here and now. Right now, there's probably, I'm going to say 85%, Deb, of the districts and schools that we have oversight on have some form of in-person, either hybrid or all in person. And that represents low 70% of our students. I'm hopeful, again, with an eye on these variants to make sure that we're keeping a close eye on that. I'm hopeful between better weather, vaccines, all the great work that's been done in districts up and down the state, that just over 70% this school year gets up to something that looks more like 85% of at least some form of in-person. I'd be disappointed if it doesn't get there. But as it relates to September, Tina, I fully expect us to be full bore back in school Monday through Friday, obviously safely and responsibly. And I can't predict, God forbid, if there's another wave coming out of left field, but assuming the trends proceed as we are expecting them to, I would expect us fully to be back in school Monday through Friday. We're still trying to digest the CDC guidance on 3 feet versus 6 feet and barriers and all that sort of stuff, all of which is important. And I speak to mayors, superintendents, educators all the time. I know, for instance, ventilation in a lot of buildings and older buildings in particular is an issue that's still outstanding. Completely get that. But there, we should have plenty of runway, particularly again with the federal money helping us between now and September.
Well, we'll make it, right? It's going to be
I really believe
a great day. So transitioning a little bit, Governor, to a question which pertains a lot to our educators and our public workforce, but also to your budget. Lisa from Voorhees is asking what steps are being taken to ensure our pension fund is healthy moving forward?
Lisa, right?
Yes, sir.
Well, I would start by saying to Lisa, I am incredibly proud that the budget I proposed a few weeks ago includes the first full pension payment since 1996. And I rarely pat myself on the back. I'm always looking in the mirror. What can we do better? How can we be better? But I'm proud of that because it's sooner than I had projected. And it is about time. I mean, I've preached this since way back. The state has lost the trust of too many folks in the years that preceded our administration, including public sector workers, educators, rating agencies. And so we can't kick the can down the road anymore. We got to pick the can up enough already. But I'll tell you a depressing statistic, and I know, Deb, you have not, to your credit, you've not texted me to speak faster or give shorter answers. But I know that you in your heart believe that at the moment. I want folks to listen to a couple of numbers if they could. So the pension payment in our budget, round numbers, is $6.4 billion. I mentioned the last full payment was 25 years ago. It was $223 million. If we had paid the full amount every year since, Deb, that 223 would have risen in this budget year to 800 million. Which makes sense. That number is going to go up. So we had to put 6.4 billion in instead of 800 million, which means of the 6.4 billion, $5.6 billion in one budget alone is the delinquency fee that we have to pay to make up for all the carnage and lack of paying the full pension payment that came before in the past 25 years. It's outrageous. Taxpayers should be outraged. Folks who benefit from the pension system should be outraged at the history, that is. But I'm committed to staying there, Lisa, going forward, and we'll do everything we can to stay at 100% for as long as we're around.
I've heard lots of support for that, because I know it's meaningful to people who have pensions. It's also meaningful to the way that our rating agencies look at the state, right? It has an impact on the whole view.
You betcha. I'll be with the rating agencies later this week, and that's a listen, we're doing what we said we would do. They view it basically as a quasi-legal obligation. So they view it a lot closer to a bond and paying interest on a bond and paying principal on a bond than they do anything that's discretionary. And frankly, they're right.
As you have always said, it goes to keeping our word, right? Let me ask
By the
you
way,
another
one other point. I feel like Nikita Khrushchev. I'm going to take my shoe off and bounce it on the table here, and with such passion. But it's also the hundreds and hundreds of thousands of current employees and retirees who have families, who have mouths to feed, who depend on the state's word for us to be there for them. And I could go on, I won't, but please thank Lisa for that.
Got it. Hopefully she's listening.
Yeah, I hope.
I'm going to ask you another question on budget, if I could, because one of the new initiatives in your fiscal 22 budget was Cover All Kids. So Peter wants to know if you could just give us a little bit more detail about the budget proposal for Cover All Kids, specifically covering, kids who are currently ineligible in the New Jersey family care.
Yeah, I'm incredibly excited about this. Peter, right?
Yes, sir.
I love this one. I think this is high on the list of why people should live in New Jersey, because we take care of everybody, not just some. It's Deb, if I'm not mistaken, it's a $20 million item in the budget, which when you think about it, given the reach, might be the bargain of the century if this means all of our kids get covered. I think the expectation, and if this is not right on the money from our human services or Dobie or other colleagues, please help me follow up with Peter. I think the expectation is the beginning, if the budget passes as is, beginning next January, it will be in effect, and it will do things like eliminate like waiting times on the children, the federal CHIP program, and the acronym I always forget what Children's Health Insurance Plan or Premium. So reduce premiums, eliminate or reduce waiting times. I think also enhance coverage to include folks who just flat out are not included in the CHIP program as it stands. And that might be, by the way, specifically because of a family's immigration status. And so that they would be included as well. I think Peter should know that some of this, I mentioned January of 2022, will be live then. And I think some of it will take longer to get unfurled and in place. But this is, beginning in January, and my guess is it's fully in place within 2 or 3 years. And again, I think it's a game changer.
Looking forward to seeing that across the finish line when your budget's completed by the end of June, right? Maybe earlier. So I have a few more questions for you. I think we're doing okay for time. My next one is admittedly a compound question because Elisa from our friends at New Jersey Organizing Project packed a lot of questions into one. So bear with me.
Okay.
They're really interested in knowing about the resources that we're using to combat the overdose crisis.
Yep.
They're also asking a little bit around the rental assistance programs and that are directed both at tenants and small landlords and also mortgage forbearance. And then the final part of the question is about the monies and how they can be used from the American Rescue Act. I think she's been watching your press conferences where the reporters get to ask 4 or 5 questions in one, right?
I love that. I'm just making notes here myself.
So the overdose crisis,
yep.
Rental and housing assistance, and the American Rescue Act.
Yeah, so the American Rescue Plan, I think we're waiting for guidance on that from the feds. A friend, Bill Rogers, who I've known for 15 or 20 years, is on our Restart and Recovery Commission, has that great phrase that I know you love as well: money for relief, recovery, and reimagination. And I think those are themes that we're going to be pursuing. But we're still awaiting guidance of the American Rescue Plan. It's a big amount of money for Jersey. Folks, I should say this, 6.4 billion, I think it's at the state level, just under 3 billion at the county and local level. Another, call it 6 billion in things like, direct monies into transit systems, education, childcare. In other words, those pieces are prescribed at the top line level. And then those checks that people are getting, that adds up in New Jersey to another $10 billion. So when you add everything together, either through government into direct programs or to families themselves, it's a $25 billion reality, and we will use every penny of that. Listen, on opioids, again, over 3,000 people perished last year. It was not up as high as we thought or feared, but it's still 3,000 and something too many. January and February of this year were really bad, as were January and February, by the way, last year, pre-pandemic. We've spent, I think, Deb, you correct me if I'm wrong, over $200 million already in our time on evidence-based programs. We will continue to do that. There was a question earlier about mental health. This is all tied in together. A lot of people struggling, and that means the challenge that we inherited in a more peaceful time with the opioid crisis has gotten even more acute. I like the programs that we have in place. I just am desperate that we see the numbers bear that out. And I think the pandemic took us sideways in that respect. Perhaps not as much as we feared, but still took us sideways. I wrote down rental assistance. So I guess the other question, is it Elisa?
Yes.
So we've done a fair amount, actually. We put, I think, $90 million in Sheila Oliver, who's been doing an incredible job, not just as lieutenant governor, but as a DCA commissioner, has been really driving this. $90 million in coronavirus relief funds that was distributed already on a lottery basis. I think we had another 29 or $30 million in federal grants, and that included, as I recall, included things like homeless prevention programs. I'm making a note to myself here to make sure I get this right. And again, we'll follow up with Alyssa if not. Last week, Sheila announced opening up of a window of application of phase 2, so-called phase 2 rental assistance program, which I think is open today. I believe the application window opened today. And that's over $350 million of CARES Act money. So we're putting, and I would suspect, to Alyssa's question on that third part on the American Rescue Plan, I'd have a strong sense and bet that there's going to be money in the future federal money, just as we've been able to deploy in the monies so far.
Wonderful. Masterful. You got all three in there. Thank you. I have 3 more questions for you. I think we have time. So let's see how we do. Christine is asking us around, and she actually starts by thanking you for the dedication of $60 million for water infrastructure improvements in budget. And what are the water infrastructure challenges that you're prioritizing to use these funds for?
And it was Christine, right?
Yes.
Well, listen, we have, I am very proud of the fact we're dedicating $60 million to water infrastructure improvement. We are, like a lot of America, particularly the Northeast and upper Midwestern states, we've got a lot of aging water infrastructure. In some cases, by the way, Deb, we still have wooden pipes in New Jersey. Think about that. Those are 19th century. It's possible they're even 19th century, possibly even 18th century. So the $60 million commitment will allow our Department of Environmental Protection to continue to address it aggressively. We've seen great successes already. We have worked very closely with great Mayor Ras Baraka in Newark, with Essex County. They've made an enormous amount of progress on that. I also want to look at the federal money potentially there as well, because it's possible there's some water infrastructure money. I'm not sure in the American Rescue Plan, but President Biden has spoken quite forcefully and with great passion about an infrastructure renaissance in our country. And that has to include water infrastructure. When people hear infrastructure, they think, as they should, roads, bridges, tunnels, the Gateway project in our case, all of which we desperately need. But it's also water, it's broadband, it's other areas as well. So, Christine, we will stay at it. 60 million is not enough, but it's a start, and we will stay at it. And I have a pretty high degree of confidence the feds will be our partner and stay at it with us.
Thanks, Gov. I'm going to ask two more questions. This one's, I know what's close to your heart and something we've worked really hard on in your administration. And I'm reminded that it was March 13th of last year when we had to cancel your big multi-state symposium on gun safety that you were going to host here in New Jersey. And it's something we haven't talked a lot about this past year because of the pandemic. But Patricia did write in and asked if she's wondering if you're satisfied with the current New Jersey gun control laws, because they seem light years ahead of other states, but it's not something we've talked about recently.
Yeah, boy, that's the verb that she used was satisfied, I believe, right?
Yeah.
So the answer in a very specific and narrow sense is no. But that's not to say that the premise of, is it Patricia?
Yes, sir.
Of Patricia's question is not right, because we probably, I think the Giffords organization, which is Gabby Giffords, former congresswoman who was shot multiple times, including in the head, but made a miraculous recovery. The Giffords organization ranks states and they give them a letter grade. I think we're one of only 2 in the country that got an A. And so that is something that that we should be proud of and we should celebrate. I think I've signed over 10 laws, a half dozen executive orders, another bunch of bills that are on violence intervention. Happy with all that. There's some unfinished business though. I'll give you one example. Regulating, and this, by the way, doesn't have anything whatsoever to do with anyone's Second Amendment rights, but regulating ammunition, not just guns. As one of my friends reminds me, a gun without ammunition is a paperweight. But right now, we have a lousy way of tracking ammunition in our state. And that is, that's something that we need to regulate. And it's also not in a database. It's a paper system. So you sell some ammunition, Deb, in your shop, or I sell on mine. There's no common place that you can go for that. The other big hesitation, Patricia, I have is we need national laws. And so as good as we are, and I hope that we'll be even stronger, we are not an island. Guns come across our borders from states like Georgia, just to pick a state that has a lot lower level of gun safety laws than we have. That's probably the understatement of the year. So that's the other reason why satisfaction is not my belief. It's yes, somewhat to do with the fact we need to do more in New Jersey, but we need national action here. Universal background checks, overwhelmingly, I think it's in the high 80% of Americans support that, including by definition a lot of Second Amendment people. But there's a gap between that sentiment and the lack of action in Congress. And until that gap is shrunk, I will not be satisfied. Happy about the progress, but not satisfied.
We'll keep working at it.
Do we have time for one more? I know the clock is.
I would love it if I could sneak in one more. This one's from Barbara. As I know you know, last year we were able to see one of your signature pieces, the millionaire's tax, come across the finish line and get signed into law with the budget. Barbara's wondering, should we be worried about millionaires leaving the state of New Jersey? And how do you look at, there's always a lot of talk about taxation and the cost of living here. How do you look at the picture of our state in relationship to taxes and to the value that it has to be living here in New Jersey?
And the value?
The value that, you know, we get for the money we pay, right?
Okay. I'm not sure I have enough time on this one because this is a good one. It's not a good one because it's necessarily pretty, but it's a good one to hit. First, on the first part of Barbara's question, if I understand it correctly, there's no evidence that folks are coming or going based on their income tax. We've looked at study after study. I've looked at the Jersey specific data. And particularly the past year, as folks probably know, because you see it in your neighborhoods, people are moving to New Jersey. I mean, the housing market is as hot as it's ever been. And that's because people want to, you know, they're re-embracing a backyard, et cetera. I'm not sure if that lasts forever, but that certainly has been the case in the past year. How do I see taxes and value? So back when we were a AAA rated bond state, we were never the low cost place to live, but we were in that great, on our best days, folks knew they paid a premium to live in a place like New Jersey, but they also knew they got a really rich basket of stuff back. Quality of life, great public schools, great healthcare, location, talent that you could hire in your business, you know, diversity, on and on and on. And since those days, that was back when Governor Kane was governor, in the intervening decades, the premium to live here had gone up, and up, and the basket of stuff that you got back for that had shrunk. And that's the reality we inherited. And we've been committed to day one to getting that back into balance. Now, we've had good news in our first 3 years. We've had 3 of the lowest 5 increases in property taxes of any years that have come before us. And, you know, I'm happy about that at one level, but I'd like to see, you know, we want to keep pounding away on the premium and get it going down, not up at a slower rate. I'm particularly proud of the investments that we've made in that basket. And that's where I think you got to think about the total value for money question, which I think is what, I just took my glasses off, what Barbara
yeah.
is asking, which is number 1 public education system in America, U.S. News and World Report, number 4 healthcare system in America, a location that is second to none, highest concentration of scientists and engineers per square mile of anywhere in the world, the most diverse American state, which we wear as a badge of honor, quality of life, all-time investments right now in this administration in infrastructure to make this an easier state. It's the densest state in America, which kills you with a pandemic, but you want to be able to take advantage of that density, including moving around. Investment, all-time record investments in pre-K expansion, K through 12, higher education, workforce development. We embrace organized labor in this state because as organized labor goes, so goes the middle class. And in New Jersey, as the middle class goes, so goes New Jersey. You know, certain states lead with, you know, a particular attraction. Some lead with warmer weather. So I can't do much about the weather other than to manage the reaction to it as best we can. A lot of places talk about low taxes. I get that. But if you're working full time, you've got a commute, you've got kids you want to get educated, you want to be in a place that on a Saturday night you can enjoy a whole range of different options. If you get sick, God forbid, you've got great quality health care. The list could go on and on and on. It's a long basket of why folks choose to live here, choose to plant their business flag here. And that's what I'm committed to. Doing the best job we can to gut that premium that had gone up wildly before we got here, and pump up that basket of stuff such that you look at that and say, like the Cover All Kids, Deb, I mentioned earlier, that's a reason you should want to live in New Jersey. As one example, expanding pre-K as aggressively as any state in America. That's another reason you should want to live in New Jersey. Number one, public education system. Number four, healthcare. Our incredible diversity, our international mindset. More kids as a percentage take foreign languages in New Jersey than any other American state, and it isn't even close. That says something to me, not only about our education system, about our kids, but our mindset. I could go on and on and on. I just want to say thank you, Deb, to you for being a great moderator, and Michelle for convening us, to the many hundreds of you on this call. I know a bunch of questions have popped up. Deb has got them. We will follow up on them. As you heard from the questions I got asked, it's not like we only got the easy questions here. Some of this stuff is hard, but we're doing everything we can, and I can't thank you enough for your help in so many respects, for being there day in and day out. Stay safe, stay well. When you're eligible, get vaccinated. Make sure you're continuing to wear your face coverings. In fact, I will cover up myself before I walk out of this room, even though I'm here by myself. Do the right thing, social distancing, take yourself off the field if you don't feel well. And I'll tell you, we keep doing that stuff. We get the vaccines further rolled out. We're going to have a great Memorial Day onward. I really believe that. And here's to better times ahead. Thank you all.
Thanks, Governor. Have a great evening. Stay safe, everybody.